In this evening's edition of the Health Report, Shamela Pullen looks at the Omicron variant of the coronavirus.
On November 26, the World Health Organization (WHO) designated the Omicron variant, originally referred to as B.1.1.529, a variant of concern. It was first discovered in South Africa. Omicron is of concern because it has a number of mutations that makes the virus likely to be problematic. But so far, the symptoms are mild. That, however, could change as research is ongoing.
It is already being seen that there is increased transmissibility. There has been a sharp increase in the number of cases in South Africa over the last few days. And it is this that is a little troubling in terms of what people are thinking in terms of how this virus may be presenting, including increased numbers of infections.
It is also still unknown how effective the COVID-19 vaccines will be against the virus. With reports out of South Africa about breakouts in infection, even among persons who have been vaccinated, it's predicted that there will be reduced efficacy in some vaccines.
But the vaccine manufacturers are currently testing their vaccines against these agents, and that information will become available hopefully within the next week or two. And they are also making preparation. Moderna, for example, has a prototype vaccine already in place, ready to be tested. Pfizer is also looking at alteration to their vaccine to be able to accommodate this changes in the virus.
But persons are still being encouraged to get vaccinated, as the COVID vaccine can still offer some form of protection, especially against other variants. Researchers in South Africa and around the world are conducting studies to better understand many aspects of Omicron and will continue to share the findings of these studies as they become available. Meanwhile,
everybody has to be vigilant in terms of their, strengthening their already what we're accustomed to, wearing your mask, washing your hands, social distancing. All of these measures need to be reinforced so that we can continue to protect ourselves from any new variants that come out, including the Omicron variant.
With your health report, I'm Shamela Pullen wishing you good health.